Hi, I'm Dana J, and this is Henry Ford Health System News, a look at the way our team members are working towards excellence in the science and art of care. We're going to start this time in the Department of Orthopedics, where groundbreaking research is proving that patients don't need opioids to manage pain after knee surgery. About 60 patients under the age of 45, most with knee injuries common in active people, participated in the study, which was recently published by Arthroscopy, the Journal of Arthroscopic and Related Surgery. All of the subjects had surgery on their meniscus. Half got opioids or narcotics to control pain. Half were on a non-opioid regimen, anti-inflammatories, acetaminophen, and muscle relaxers. Chief Resident Tufik Jilde led the study.
So our study found that our non-narcotic protocol was able to provide equivalent or better pain relief and maintaining excellent patient satisfaction without the use of opioids whatsoever.
Jilde says the results of the study are a first step toward eliminating the use of addictive opioids to relieve pain after other surgery, too.
I think when patients found out that they can actually undergo surgery without using opioids whatsoever, people were pumped.
In 2017, the U.S. Department of Health declared opioid abuse a public health emergency. In 2019, more than 10 million people misused prescription opioids and more than 50,000 people died from opioid overdose. Orthopedic surgeons are among the highest prescribers of the drugs because opioids are effective against musculoskeletal pain.
I think the responsibility lies with physicians to manage postoperative pain while decreasing the opioid burden, while also maintaining excellent patient satisfaction. And I think orthopedic surgeons are well suited and in a position to really have a positive impact on the opioid epidemic.
The Henry Ford researchers started with meniscus surgery because it's most common, and patients typically experience mild or moderate pain after surgery. Jilde says ongoing studies are showing non-opioid regimens are effective after other types of surgeries, too.
We've proved this in meniscus surgeries. We are in the process of proving this in ACL surgery, shoulder labrum surgery, as well as rotator cuff surgery and shoulder arthroplasty. And so far, our results have been overwhelmingly positive.
The non-opioid approach is now the standard of care here at Henry Ford when it comes to managing pain after meniscus surgery. The team believes they are among the first in the nation to adopt that approach. Henry Ford Allegiance Health has teamed up with Jackson County to vaccinate local college kids, busing them from campus to the mass vaccination site at the Jackson County Fairgrounds. Team members from the sports medicine department stepped up to help meet the demand.
We're excited to be here. We're slated to give close to 1,000 vaccines today, most of which going to students in our community. And over the next week or so, we'll be expanding that and giving more students vaccines. Our department reached out and coordinated efforts with our population health leaders, particularly our clinical staff that work with me on a day-to-day basis. So we actually pulled them out of my clinic and we brought them here to do this and accomplish something bigger than us and bigger than sports medicine. We're just real excited to be here, and we're excited to get shots in arms and put this pandemic behind us as soon as we can.
It's now easier than ever to get your vaccine if you haven't already. Team members can walk into any Henry Ford mass vaccination site or employee health location, no appointment necessary. Some businesses along West Grand Boulevard, just down the street from Henry Ford Hospital, are getting a facelift thanks in part to Henry Ford. The health system teamed up with Midtown Detroit Inc. and the Kresge Foundation to find ways to help longtime business owners like Harold Hackett improve their facades. Hackett has run his salon since 1988. His building is 100 years old. Hackett says he saw the neighborhood improving, and he was afraid he might not be able to keep up.
I just didn't have the money to keep up, and I thought I'd be out of date. Or the city would force me to do things that I just didn't have the money for, and it was pretty difficult. And then I would just say a blessing came along.
That blessing came in the form of a $20,000 grant funded by the Kresge Foundation. Harold's place got a new awning, and a new sign is on the way. He says he and his fellow grant recipients will fit right in with the new and improved Motown Museum across the street.
We look good. We look really good. And across the street, Motown remodeled its entire facility. It looks great. I feel like a millionaire now.
The Facade Improvement Program is just one part of a plan developed by Henry Ford to reach outside the hospital and the cancer pavilion and help the neighborhood. And now let's do the featured photo. This time we're recognizing one of our extraordinary nurses. Ann Allen is the very first Daisy Award honoree for Henry Ford Medical Group's ambulatory nursing. Ann is an ambulatory surgery nurse at Henry Ford Medical Center Cottage. She was nominated for the award for going above and beyond for her patients and co-workers. She's also been recognized by the city of Detroit for her compassionate care while working with patients at drive-through COVID testing sites early in the pandemic. Congratulations to Ann. And let us know what your outstanding teammates are up to. Send us story ideas or photos to newstips@hfhs.org. Thanks for watching, and I'll see you around.